This is the 15 years female patient complaining of pain in periumbilical region since 1 month, and 5-6 days episode of fever before 10-15 days. Pain is since 1 month, and it is a case of appendicitis with thickened cecum and ascending colon. This is the, we will go step by step. This is the appendix. It was measuring 7 mm, and this is appendix, and this is the cecum. If we trace the appendix, here there is a continuation of appendix with the cecum. This cecum is significantly thickened and symmetrically edematous, with wall preservation of wall stratification. If we go further up, still the ascending colon is also involved here. The probe is placed on right hypochondrial region, and taking the longitudinal section, this is the cecum with ascending colon. I think there is a ileocolic intussusception also. This segment of the small bowel is seen invaginating into the cecum. Very mild degree of intussusception, ileocolic type. Or it could give false perception also of intussusception due to this thickened ball. I think this is not an intussusception. This is the ileum, this is appendix. Here the appendix is normal. Here at the base, this appendix is measuring roughly 3-4 mm only, but as we go distal end of the appendix, it is getting enlarged. Here at the tip is quite swollen, 7.7, at least 7 we can say. There are multiple enlarged lymph node also here. And there is involvement of the transverse colon also. If we trace this ascending colon, this is going towards the right side, and further tracing we can see this transverse colon. This is the transverse colon. The probe is placed over here near the umbilicus in the transverse plane, and if we go on tracing this transverse colon, here near the splenic flexor, it is becoming normal. Further we cannot see this thickened bowel large colon. This is once again ascending colon and cecum. This is the ileum. This is the ileocecal junction over here. could be mucosal of appendix, I think, because there is free fluid inside the appendix, and due to excessive distension of the mucosal of appendix, it might have ruptured or perforated. However, we cannot see the free fluid because it is a long history of 1 month, so might be the fluid might have absorbed. But patient is not having so much of pain. If we compress over here, patient is not having pain. So in mucosal of appendix, this kind of findings are seen, where the patient does not have much pain, but patient is complaining about the periumbilical region pain, and these are the multiple lymph nodes. It could be due to this chronic inflammatory changes secondary to suspected ruptured mucosal of appendix, perforated mucosal of appendix. The cecum is nicely visualized. Let us see the vascularity. Not much vascular. Mild to moderately vascular ascending colon.